Welcome back to American Agenda. According to new data from Johns Hopkins, global deaths from COVID-19 have surpassed 5 million people worldwide. But as more and more people get vaccinated and numbers begin to fall, it begs the question, is the pandemic over?
Yeah, when is it going to be over? One person who actually thinks that it's time to get back to everyday normal life, one of many, Bill Maher. Listen to what he said on Friday night.
I'm not sure what the latest Dr. Fauci thing was on Halloween. He changes his mind a lot, but I think it was go and do it. I hope so, because it certainly has been my position since the beginning of this. Just resume living. I mean, come on, the 15 of 100,000, that's where we are cases in California. 15 cases per 100,000 people. I know some people seem to not want to give up on the wonderful pandemic, but you know what? It's over.
There you go. Joining us now to discuss, Florida businessman, lawyer, and GOP strategist Ford O'Connell, and host of Money Talk with Melanie and Project 21 member Melanie Collette. Melanie, he also went on to say that different states are, he said the red states are a pleasure, and it's the blue states that are a real pain. And this is a guy known to be liberal, but even he is, I'm sorry, go ahead.
Yeah.
Okay, let's listen to what he says there. Go ahead. Okay, forget it. If we can't roll it now, let's go to Melanie and let her comment, since I had such a good start talking to you, Melanie. But that's where we are, that even somebody liberal is looking at this and saying they've had it up to here, let's get on with life.
I tend to agree with him. I will say that I'm a bit conflicted, because I have people in my life who are immunocompromised and are still very, very afraid of the coronavirus, and so they're still living their lives as if it was the very beginning, and you can understand why they do. And a lot of people are very kind of like inconsiderate of people who are immunocompromised and still afraid of the coronavirus, because for them it really can be death dealing. But I think overall, and generally speaking, when you speak of the statistics being what they are, 15 in 100,000 sounds like statistically it's over.
Yeah, Johns Hopkins also found only 72,000 new cases of COVID per day over the past week. Now, that number is down 58% from September's high, as cases have fallen in nearly every U.S. region. And the Department of Health and Human Services reports that only 51,000 Americans are currently hospitalized with COVID. And Ford, I know your state of Florida specifically has the lowest numbers after, being open or opening up from almost the beginning. I know during the initial phase of the pandemic, they did shut down somewhat.
Look, long ago, Florida Governor Ron DeSantis realized that there is no one-size-fits-all solution to COVID, and there's very little political action that can be implemented to stop the spread. But if we also step back and realize that 60% of Americans have had the COVID shot, and then you factor in natural immunity as well, 70%.
Yeah,
and you realize that we are basically at herd immunity in the United States, and therefore, unless you're someone like Melanie's talking about, who needs to be safely to themselves, Bill Maher is absolutely right. You need to resume living. In fact, we probably should have been resuming living about 7, 8, 9 months ago nationally, because Australia and other countries prove that this idea of getting to COVID zero is a fool's errand, and it's only going to destroy your country and its economy.
Yeah, there's going to be another variant. There's going to be a Delta. There's going to be an American.
Delta Plus.
There's going to be a Southwest. They're all going to have variants. And by the way, I think it's time that Ford got out of his spaceship and was able to go out and live normally. By the way, Bill Maher also says you shouldn't have to wear a mask anymore. Listen to what he said here.
Vaccine, mask, pick one. You got to pick. You can't make me mask if I've had the vaccine.
Yeah, and Melanie, I completely understand what you're saying. There can be people immunocompromised. Those are the people we want to protect. We also need to protect people's jobs. And the thing that I worry about is we're getting toward the back end of this, I hope, fingers crossed. And I'm going to go live either way, have been all along. But we're right at a point when people really want to get back to normal. They're imposing mask mandates. They're imposing vaccine mandates. They're doing all these oppressive things. And I think people really have had it.
I think people have had it. And I think, if you are immunocompromised, you need to definitely wear a mask.
Right.
I also think, and you know, I had a conversation with this relative a couple of weeks ago about this, that if we're out in public, if we're not wearing a mask, we probably should social distance, just as a precaution, because we don't know when we're out in public, when we're out shopping or whatever, who it is that we're around and what their situation is. But I kind of agree that the mask thing, I'm so over it. Like I enjoy breathing, and I'm over it. But I do think social distancing is a good thing to do when you're out in public among, you know, people. Just keep your distance a little bit.
Yeah, but also what's happening now, as you mentioned, with these vaccine mandates, Bob, specifically here in New York City, when we're talking about firing people or people losing their jobs who are these first responders, in an effort to save lives by forcing them to have the vaccine, you're going to cost lives when it comes to responding to emergencies here in New York City.
Absolutely.
No sense at all. All right, everyone, stand by. Don't go anywhere.